Hello everyone, welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. We are lucky today to have Dr. Achina Stein, a functional medicine psychiatrist. I'd like to thank everybody listening. And Dr. Stein, it's afternoon in New York, early afternoon, is that right?
Yeah, 1:11 p.m.
Thank you for joining us.
Oh, you're welcome. Thank you for having me. I'm really pleased to be on your show.
So your credentials are impressive. I'll briefly summarize and then have you please add anything to the intro that I missed or that our listeners would benefit from knowing. So you're a DO, an osteopathic physician, board certified psychiatrist with 25 years of experience, a lot of psychotherapy provided, focused on trauma, work with prison population, community mental health, chronic and persistent mental health issues, geriatric psychiatry. Had some things that sound like they'll be really interesting to delve into. Around 2010, your son's issues were moved forward by functional medicine, which sounded like it was revelatory for you, influenced your path. And now Functional Mind LLC, providing online health coaching, HealthySelf Bootcamp, and a way for people to work remotely, which I think will be really important at the end of our conversation so that people know how they can access these new resources that you're creating. Your summary says that you're an MD, psychiatrist, psychotherapist, nutritionist, and health coach all in one. That brings a lot to the equation. Anything you'd like to add to the interview that I should have put in or that fleshes it out more for us?
No, that's you did say everything that was correct. Do want to make a slight adjustment. I'm a DO, so when you said MD, I'm actually, so MDs, medical doctor, and DOs are also medical doctors, but
right, I misspoke. Sorry about that.
Yeah, we're both physicians, but
of course.
I have different training. So
yes, absolutely. Yeah, the DO distinction is fascinating. Most of my friends who are DOs tend to come into it with a little bit broader, more sort of functional-like background, perhaps. And then for our listeners that might not be aware of it, MDs and DOs have been candidates for in parts of the same medical community in terms of residency training in psychiatry, surgery, internal medicine, what have you, for decades. So a really interesting part of that story.
Yeah, we tend to have a more of a holistic approach, and DOs tended to be more family doctors like yourself in the Midwest, because there was a great need for family doctors, decades ago. So the government actually supported the increase of osteopathic medical schools for that very reason, to provide more GPs and FPs in the suburban and rural communities, particularly.
Well, that's reflected. Fast forward to Alaska right now, we have a DO general surgeon and a DO who's leading the charge on our COVID-19 response. So testament to the power over time.
Yeah.
Are you safe and okay in terms of you and your family? They're in New York right now in the midst of all this. I can't resist asking about your well-being.
Well, actually, I'm in Rhode Island, so I'm about a 3.5-hour drive from the New York City area. So I'm in the suburbs of Rhode Island, and I have Boston about an hour and a half from me. So Massachusetts was a little bit hit harder. I think it's the cities that tend to be more of a problem. Fortunately, we've had a number of cases of COVID-19, but nobody has, cross our fingers, no one in Rhode Island has passed away from it. So
good.
Good. So it's been, I think everybody has been doing their job, distancing and isolating and, really shutting things down. And I think of finding a new way of life and exploring those opportunities. There's things that you can, find yourself doing.
Blessings of adversity.
Exactly. Yeah.
Well, I got fitted. I was fitted for my N95 mask this morning, so it clearly must have rattled me a little and boggled a few details. So it's gracious of you to let me get it right as we go. Thanks.
Yeah.
So it's so exciting, the information that you've shared about what we'll be talking about today. And I see that your sort of target audience, you treat men and women from 18 up to 78 years of age, but your focus is the multitasking, busy, married woman, 35 to 55, given a diagnosis of depression. They don't think they're depressed, and then they wonder if they should take an antidepressant. Is that a good place to start with what your passion is and how you help people?
Well, I find that a lot of people who find functional medicine are people who are really frustrated with conventional medicine. They don't feel well at all, and they're trying to get answers, and they go to their primary care physician or a specialist, and then they find that they're sort of just spent 15 minutes with them. They arrive at a quick diagnosis, and then they're provided a prescription. And one of those prescriptions might be an antidepressant, or it might be, something else too, but it's that experience that I find happening over and over and over again. And then people are quite surprised that when they see me, I spend 2 hours. I give them a 39-page intake first, which I look at before I even see them, and spend half an hour just doing that. And then when I see them, I spend 2 hours with them collecting all sorts of data and trying to put the pieces together of their puzzle about why they're not feeling well. And then after that, I provide a very long treatment plan that addresses food, movement, sleep. It's a variety of things that can be addressed in order to remove the causes of their symptoms, that they're having. So it's getting root cause as opposed to arriving at the diagnosis, which is what, we do when we arrive. We're looking for what is causing the problem in terms of like a diagnosis in order to sort of match a pill to an ill, as opposed to looking for the root causes, the why, why am I suffering? Why am I having these symptoms? And it's a different approach. It's not one's wrong and the other one's right. It's that they're for different reasons. I think it's, as it's really important to arrive at a diagnosis very quickly in order to address it immediately. You want to be able to diagnose coronavirus very quickly in order to know exactly what to do immediately, right? We want to isolate you. We want to start the treatment or whatever it is, depending on what they're experiencing, to be able to respond very quickly. But functional medicine addresses very well the chronic issues that people have. And so conventional medicine tends to do very well for acute issues, whereas functional medicine does a really good job with chronic issues. And I think that both worlds can function, in the same sphere or together. They don't have to. It doesn't have to be either or. It can be both.
Yes, I find that a lot of the people that are in my exam room, again at the beginning of the process, they've filled out all the information. We built their matrix. They have a sense of relief when they hear that their diagnosis can help tell us and illuminate what's happening,
right? But
that they're not tyrannized by it,
right?
That it's not like a diagnosis of a broken bone or bacterial pneumonia. It's not a one item, one fix issue. Right. It didn't just come from sort of the blue. It has these origins, and they're so relieved also when they get underway. Their food starts making a difference, their lifestyle, their meditation, their movement, etc. I'm sure our listeners are curious, given that we face these challenges so much in the early going. People are both, I presume in your practice and certainly in mine, they're intimidated by the possibility of medication, but they're also feeling a sense of, well, this might be necessary for me. And I'm sure our listeners are very curious, with your experience and expertise and the severity of what you treat. How do you make those decisions in the early going when people ask you about medication?
Well, it depends on, I'm assuming you're asking the question is that they're not on medication yet. So,
if they're, yeah, I suppose I'm trying to think of what'll help our listeners most. And so let's presume this is somebody, new diagnosis, depression, no medication, and they have trepidation. Medication's a new world for them.
right.
And I'm sure you see and treat lots of people who've been wedded to medication for years, but that may be a little overly multifaceted for the beginning of our discussion. So no medication yet, and they think, oh my gosh, do I need Zoloft or not? Is it safe? How do I figure it out? My symptoms are severe. What if my symptoms take me down? What if I get suicidal? They're intimidated.
Absolutely. Absolutely. So I think safety comes first. Absolutely comes first. So I would want to make sure, and I do, when I first meet someone, I want to make sure that they are safe. And that might include, obviously having suicidal ideations. And, there are some people who have chronic suicidal ideations and they have no intent on acting out on those feelings. That doesn't mean that doesn't cause distress. Certainly it can cause some distress when you have suicidal ideations, but as long as they don't have an intent or a plan. I mean, sometimes people have plans and they still never intend to follow through on those plans. So, it's sorting those kinds of things out. And, that being said, I think that would be a reason right there to start an antidepressant. But you want to make sure that they are in a safe place and that they're not going to harm themselves. And that might include having to be in the hospital if they aren't able to keep them safe. So if they are in the hospital in a safe environment, that's also a safe place to start an antidepressant. Because antidepressants do have their benefits, but they also have their risks. And there's a small chance that you can have increase in suicidal ideation when you start, because sometimes you can then have the energy to follow through. So, on those thoughts, because sometimes people don't follow through on a plan because they don't have the energy. So it is being in a safe place first. And then definitely if they are in the hospital, I would start an antidepressant and monitor them for a period of time so that they aren't going to follow through on those kinds of thoughts and feelings. That being said, the other reason to start an antidepressant is your ability to function. So, I also see, so it's a conversation, because there are people who have never had an antidepressant. And so we have no idea how quickly that antidepressant is going to work for them. Mm-hmm. So it's going to be based on a number of factors. If I do an evaluation and I find that they are, there's lots of things they could do in terms of changing their diet. I've seen people feel significantly better just by changing their diet in 3 to 4 weeks. So, it's looking on their history, their matrix, as you mentioned, and I put all their history on a timeline. It's looking at all the possible factors. So I might decide for them that, let's say they're eating gluten and dairy and lots of processed foods and lots of sugar. Boy, you're going to see a lot of bang for your buck just by removing those. Really, compared to an antidepressant, because an antidepressant could take 4 to 6 to 8 weeks to get better. Mm-hmm. And if you already have a lot of inflammation on board, the antidepressant may not really make much of a difference. So if I see a history when somebody has very little inflammation in their body, let's say they're a clean eater already, right? Then an antidepressant might actually make an impact, because the way an antidepressant works is by, so let me back up. So serotonin is made in your gut. And the way an antidepressant works is by inhibiting the uptake of serotonin. It's a serotonin reuptake inhibitor. So if you don't have serotonin in your system, it's not going to have anything to reuptake. So if you already have a pretty, a healthy gut lining, then the antidepressant would probably work pretty well because you're making enough serotonin. So if you have a lot of inflammation, your gut's all, a mess, so to speak, then an antidepressant is probably not going to work or it'll work just short term because that's why some antidepressants poop out, because the serotonin is no longer there. It's not being made in the body enough to even have the antidepressant work appropriately. I don't know if I'm going a little beyond what people can understand, but that's how I kind of explain it to people. It's more complicated than the way I'm explaining it. So, but I'm trying to explain it in such a way that people get what I'm talking about.
Right. Well, a couple of things that I've heard you say that I think may be transformative for people just in the amount of time we've had to talk already is that the extra dimension then that we're feeding that serotonin into the system and the gut-brain connection. So many people are interested in that, but they love hearing somebody who knows how to use the toolbox explain the details, those fascinating parts of what's really happening. And I've noted also so many people visit 2 or visit 3, the food's making a huge difference. And the other lifestyle things, of course, but I find the food has an immediacy, the whole food, cleaning up the gluten and dairy, the refined sugar. And I just love that people also then get that kind of aha moment that depression sort of like if we were cave people, the depression sort of our body's telling us something's not right. You need to add something, you need to remove something, you need to migrate away from the volcano belching sulfur or eat more fiber or something. Our body's telling us, I'm not optimal, help me. Right.
Yeah, and it's not just depression, it's also anxiety. So I've had patients, I had one patient come to me who was having panic attacks, and that was the thing that was preventing him from actually doing his job. So that was the moment where he decided, I need help because I can't not do my job. So so he came to me for panic attacks, and then he realized, wow, I have this ongoing anxiety for a while, and it was sort of like a social anxiety, and just making the changes, he realized that not only did the change in his diet, and it was just diet alone. He was a pretty fit guy. It was his kind of job was very physical, teaching kids a certain kind of sport. And I don't want to mention this sport because then it will identify him actually in the state. So, but it was a major change in terms of not just the attacks, but also his social anxiety went away. And then after a few months, 3 to 4 months, he said, I'm not feeling depressed anymore. And it was a depression that he thought that he would have for the rest of his life because he had it since early childhood. He was raised by a single mom. He was deprived of a lot of things that other kids had, lived in deprivation and didn't really have the love that most parents would provide for the children, their children. And he thought that he would never. And he started to feel, is this joy? Am I actually feeling joy and happiness? And that was like, wow, it was amazing for him to experience that. He never even, imagined that kind of change. It wasn't even something he was looking for. He didn't even discuss that as something that he wanted to change because he thought it would never happen. So people find it incredibly transformative to do the work of functional medicine, really getting to the root cause and treating the gut. And that's what we did. We treated his gut to treat the brain and all the ways that it manifests as symptoms, not just the one way or the two ways that they're looking for.
Right. Thank you for sharing that. And I think, again, the folks listening, they're going to get a sense then that these cups of vitality spill over into one another. And so that sense of fatalism, that the depression or the anxiety or what have you came from somewhere, or that it's been there for 30 years, so it's sort of part of the picture. In the functional medicine approach, it isn't necessarily true for that person that they're fated, and the majority aren't, because the conditions from which the symptoms arise haven't been addressed.
Right.
So it's good news for people that if they haven't tried functional medicine and they're excited and interested, the duration and severity of their symptoms don't tell us much about the path forward. Right.
Yes. I think everything is a possibility. That doesn't mean to say that, there's struggles in certain areas where some, people find benefit in other areas than what they intended to address. I have a patient who came to me with the primary symptom of insomnia, and she had insomnia since menopause, and no problems with that, with the insomnia prior to that. And that was her reason for coming. But she had all these other issues that she didn't even realize that she had, upper respiratory issues. She had lots of allergies. She had skin problems, and all of those issues went away with our work, but still has the insomnia. So we're still working on that. But she feels fantastic, has a lot more energy. Her brain fog went away, and that wasn't the reason why she came to see me, but we're still working on the insomnia.
We never know how it's going to go, do we? But then as their vitality comes back, like you say, they're more resilient, they're excited. I think they sense then that we can crack the code on some of their tougher problems because their vitality is rebooting, their batteries are charged, they're brighter, they feel more buoyant.
Yeah. So the question that comes up for me, and with her in particular, and this is something for people to think about, is that she gets 4 to 5 hours of sleep and she's feeling great. So I'm thinking, well, maybe you don't really have insomnia because you have this idea that you should have more than 4 to 5 hours of sleep. Maybe you're just lucky that's all you in particular need. There are people like that, right?
Right, I've met a few. It's mind-blowing.
Right, and maybe that's your normal and you don't really have insomnia, even though prior to menopause, you had more sleep, but maybe you needed more sleep then because you were so inflamed.
Right, and it also flags that dynamic engagement that we get to undertake with the person as a team, where we see what emerges and where things go, and then we reframe things. We say, well, if you feel great and you're rested and you're bright-eyed and you're making good decisions and you're able to work and you're nice to your kids, and what's the problem?
Exactly. So maybe she came for a problem that she thought was the problem, but there were really all these other problems that were making her feel bad. And it has nothing to do with really not getting enough sleep. Yeah. In the end, I'm like, I didn't know that in the beginning, but now in the end, as everything's unfolded and things were sort of resolved over time, I'm now drawing that conclusion. Do you see?
Yeah. Right. My old karate instructor said the day one of class when I was in high school, he said, the reason you came in the door isn't the reason you'll stay to get your black belt.
It's exactly.
And for me, it was bullying. And then when I got my black belt as a senior in high school, it was because of what he called do, or mastery, sort of mastery of the self, the way.
Right.
And I wasn't worried about bullies anymore somewhere around 6 to 12 months in. And then I heard an expert interviewed by Dr. Kara Fitzgerald the other day say that so many functional medicine plans are similar. So what brings the person to functional medicine, there's so many doorways in, and then there's so many similarities within the process. Right. Stress, sleep, food, positive attitude, social connection, movement, etc.
Right.
I want to make sure and And particularly with people being pinned down by COVID isolation right now. And perhaps maybe put the punchline first a little bit. You've developed an online, is it an online program that people can do with you and access your book?
Yes. Well, yeah, they can download my book for free from, it's a new website. Do you want me to tell you what that is now, or are you going to have?
Well, I think we should, just because I am loving getting to do these interviews, and I'm finding I have my dad's tendency toward loving to converse. He would end up in the supermarket sometimes for 3 hours while my mom waited for the carrots. And so I've got to be careful to not delve too deeply without getting something that, again, there may be a sense of urgency for our listeners today, feeling like, well, if I can't go to somebody's brick and mortar practice, what resources are there for me when I'm in my home for a week or potentially months? And it's going to be salient to folks a year and 5 years from now too, because the world we live in has so much remote access necessity. So I think if you share some of that and then we backtrack into shift and functional psychiatry, that'll be a really good use of the time we have, if that sounds like a good allocation to you.
Yeah, absolutely. Yeah. So, so my online coaching program it's not a doctor-patient relationship. It is a coaching client relationship, because I don't have I'm assuming that everyone that's on your listening to this is in Alaska, but if I only have a license in Rhode Island and Massachusetts, so this program is for people, in state, but also out of state, because I'm don't have a license in these other states. I have to be very clear that it's a coaching program, and it's to help people to figure out their own root causes, and it guides them through those causes, through basically using my book as a guide. So you can download my book from www.achinasteindo.com, and they would get a PDF of my book. And if they wanted to know more about my program, they could just sign up for a free 30-minute consultation to determine if they're a good fit for that program. But basically, it's to get to the root causes of depression and anxiety. And so even though my book is called What If It's Not Depression? Your Guide to Finding Answers and Solutions, it still applies to anxiety as well, and other types of symptoms that people are, struggling with. It's not just depression, but it applies really for all of symptoms that we see, in the functional medicine world,
Yeah.
Directed
Thank you.
Primarily to, for the depression and anxiety population. Yeah.
And how long have you had that coaching program available, Dr. Stein?
I started in January.
And what are you hearing?
So far, well, one woman said that, it's changed her life, and she actually has been quite isolated. I realized that this isn't actually, it's an excellent opportunity for people who are isolated. She's an elderly woman and she doesn't have transportation. She's kind of stuck in her home, even before the whole COVID crisis here. And it's really opened up a whole new world for her. You have to know how to use the computer and she taught herself how to use Zoom. So it is learning certain skills to be able to use the program. But she's really grateful for the program. And so she's thriving. Yeah.
I am so glad you're doing that. That is going to serve so many, and it's going to extend the reach of your healing art in such a powerful way. And there's a boundless sense, I think, to that type of expansion of one's practice.
Right.
Given that the need relative to the training, the passion, the expertise, the IFM certification, my business coach, Dan Kalish, said it's about 1,000 to 1, the interest versus availability of resource.
Mm-hmm.
So expanding a resource, I think, is really powerful part of service.
Right. Yeah. It is giving people the tools to be able to figure it out for themselves. And then certainly if they needed to do more, then they would have to find a functional medicine provider in their area. But at least it's a great way to get started.
Yeah. Absolutely. And I would think they could do maintenance with coaching too. I would think coaching is a really powerful way to do maintenance.
Absolutely. Yeah, absolutely.
Yeah.
That's what I primarily do. I mean, I see a lot of really sick people in my practice face to face. It's still what I primarily do. It's just not going to be on a one-on-one basis online. It'll be in a group format. And it's watching modules, to basically, hear what we say to all of our patients over and over again about foods, infections, toxins, stress, so I address all of those things in these modules. Yeah.
Well, and I think one thing I'd like to add to what you're saying is that the revelatory moment for me in functional medicine, I'm in my 14th year, but I think it was the last 2 to 3 years where it came into focus, being what I felt was really transparent on the front end, that lifestyle changes, the IFM lifestyle domains, sleep, movement, food, social connection, and stress management were the vehicle. And then the testing, the supplements, the medications, then take on this incredible power with the lifestyle. And I found so many folks then who expected they were going to need an adrenal test or need a medication or need 15 supplements. When they instituted the lifestyle changes, some of them had resolution. And so it's kind of nice that it either sets the stage for the additional interventions to work more effectively or be pivotal, or it creates resolution. So either way, the types of things that are addressed by the coaching, which can extend beyond the boundaries of Rhode Island, just is a mission critical part of the process. And my staff here, my coaches 3.5 years ago when this physical location was opened, they pointed out that without the lifestyle engagement, then the plan was just underpowered from the start. So that was revelatory for me.
Right. Yeah. Yeah. It is doing I find that the supplements are absolutely necessary. People sometimes are wary of doing the functional medicine route because they feel like they're just going to give me a whole bunch of supplements. But I only use supplements as a bridge to helping you meet your goals faster. And there's really only a few people that end up needing some supplements long term. Yeah. So for example, magnesium and zinc tend to be the two minerals that some people, and vitamin B6, those three things are at least in my field, with depression, anxiety, those three things are the top three vitamins and minerals that the brain really needs long term. There's actually some research that shows that people, there's certain groups of people that have psychosis, depression, and anxiety because of a much, much higher need for the body's need for vitamin B6 and zinc. So, just that combination right there is, can resolve a lot of mental health symptoms. Now, when I say that, please don't go out and buy vitamin B6 and zinc and magnesium. I mean, you really should make sure that it's right for you, Don't start taking those supplements. Not every single person that I see has those higher needs. So it's really important to make sure that you're evaluated and if those are the right things for you. So that's what I find across the board for many people.
I love what you're saying, that reminder that supplements are powerful, and because they're powerful, they're always a clinical sword with two edges, though I guess maybe not the best metaphor for healing, but the power of supplementation is mission critical, and because functional medicine supplements are laser targeted and used potently, then people being aware that that there's safety considerations. I'll be giving a talk to a local group tonight about how to boost immunity naturally. And so as I talk with them about foods that are rich in vitamin C and zinc, then I'll say, well, if you're getting your C and zinc from these foods,
right,
then you're good to go. Go ahead, round up the C and the zinc rich foods. But if you're going to supplement again, have somebody who knows what they're doing.
Right. Yeah. It's always better to get your nutrition and all your nutrients from food as best as possible. So
well, I want to make sure we're respectful of your time, and it looks like, again, best use of our time might be there's 3 things I can think of left that are really big. One is, I believe you use the acronym SHIFT for how you approach functional psychiatry.
Yeah.
Can you go into that a little?
Sure. Yeah. And it's something that people can read in my book as well. But SHIFT is, we're looking to shift people's physiology when we do functional medicine or functional psychiatry. And so SHIFT is an acronym for the 5 pillars of what we look for as root causes. Stress is the S. H is hormones, including stress hormones. I is for infection. F is for foods, and T is for toxins. So those are the areas that it's those lenses that I look for the root causes. And they tend to fall in those 5 categories. I don't know if you have that same experience, but but we want to shift physiology by addressing those areas.
I do, absolutely. And I tend to agree with the recent observation from Dr. Perlmutter that the stress one in particular, and the stress hormones, also Tara Brach kind of flagging that people end up in a bit of a trance almost. That isn't quite the right term perhaps, but this sort of short-sighted stress to stress kind of fog. Right. And so I find that the person starting with taking a deep breath, doing some mindfulness, getting some play in the equation, sort of breaking the spell, as it were. Right. And seems to be one of the art of medicine type things that's emerging, I guess, as you and I are now both well past the kind of 10,000 hour mark clinically. And I love Malcolm Gladwell saying after 10,000 hours, then there's these aha moments. And a big aha moment for me was as again, kind of the spell is broken and they have a sense of being clear-eyed and moving, and their kind of frontal and prefrontal cortex and parasympathetic nervous system kick in, then it's like the kind of the light comes on and they can see 15 feet forward to where they're going. So I love getting to witness that. Yeah.
I find stress people tend to, when they do work with me, they tend to focus on the food and the movement and all the doing of getting well, as opposed to the being, sort of allowing them to stop and be. And stress tends to take a backseat all of the time, no matter how much I stress how important meditation is, or starting a practice. And it doesn't have to be sitting, in a space, staring at a candle and saying Om. It could be, really, doing certain activities to have more awareness. It's being more aware of your surroundings, aware of what you're feeling in your body. A lot of times people are disconnected from their body, and being aware of what's happening, not just outside of you, but inside of you, and watching the interactions between the outside and the inside, and following and becoming more aware of that dance that's happening, and so, and it's not necessarily how you're interacting with other people, but how are you interacting with your environment and yourself. And a lot of times people do a lot of exercise and movement to escape that awareness. And I actually have some patients who have such structured schedules that this COVID crisis has actually caused them to, their schedule to be disrupted. And because they can't follow through with their activities, it's making them very, very anxious. And because they created the structure, for some people, I've created a structure to escape certain emotions and escape whatever it is they're trying to escape, right? So sometimes people escape by drinking alcohol or using drugs, but sometimes people escape by having very structured schedules, and now it's kind of falling apart for them. So it's an opportunity. I find that every crisis is an opportunity to sit with those feelings, create space. And so meditation is just really creating space for those feelings that are coming up, and understanding that all feelings are valid. All feelings are, they're normal. All feelings are normal and healthy. And, sometimes people have feelings of anger or, feeling guilty, these are all feelings that, and particularly anger, that some people have some difficulty handling because they don't like the feeling. They grew up with too much anger, or not having, being told that it's unacceptable to have any feelings, so not knowing how to handle feelings is hard for some people. But I want everyone to know that all feelings are valid, and it's how you act on those feelings that's important. So it's actions might cross boundaries, so it's choosing the right actions based on your feelings that's important. And so if people can create space for those feelings and validate their feelings and acknowledge them, accept them, then it's going through it rather than around it or suppressing it or running away from it, right? So it's an opportunity to get to know yourself better when these kinds of things pop up.
Gosh, I just want to, hearing you articulate that makes me pause and take a deep breath and just smile inside, because it's a beautiful articulation of a lot that matters, a lot that's transformative. And a couple of things I'd like to sort of highlight and underscore that you shared, and in a sense I'd like people to hear it again because I think it's so important, is that mindfulness and restorative practices, as opposed to the importance of our run or our swimming or what have you, is this engagement with what is. My friend used to call it radical acceptance of what is. And my aha moment or journey, I think, is kind of exemplary of this, in that in college I tried to teach myself to meditate. So that was 35 years ago. And I lit a candle, and 2 minutes later I could hear people playing badminton out in the courtyard of my dorm. And I thought, well, I'm a failure at meditation. Because I presumed it was kind of like the magic erase board, that if nothing was happening, then I was meditating. And then fast forward to 15 years ago and starting a lot of meditation at the beginning of learning functional medicine and taking the first functional medicine course in Florida. And somewhere in there, a couple of years later, a really experienced meditator said, I've got good news for you, Rob. Meditation isn't thoughts going away. It's not experiences or sounds going away or emotions. It's simply awareness of them without pushing them away or grabbing a hold of them. And then he used this visual metaphor. He said it's like the mind is this blue sky, and the thoughts, emotions, feelings, sensations are clouds. And some days are relatively cloudless, and some days are stormy with a lot of rain and wind and disruption. And he just encouraged me to be aware that the clouds always appear and they always disappear.
Right.
And to just always return to the breath. And then the sort of final part for me was being at Harvard. I got to learn from Herb Benson when he was teaching his meditation class. Right. There, he would introduce the 5-day course, and And he just said when he started studying it in the 70s and carried it forward, it was returning to a focus again and again and slowing the breathing.
Right.
And so I found then that it sort of accelerates people's path forward when we're able to talk and say, hey, good news, you might have the same to-do list go through your head 50 times during your restorative practice, whether it's yoga or meditation or heart rate variability training, or just being peaceful and attending to your breath while you listen to the sound of the creek near your home. And that's normal and natural.
Right.
And it's being in that state of ease then that takes the midbrain and reallocates executive function to the parts of the brain you want in charge. It lets your adrenals settle down. And I find people are so relieved to feel like, oh my gosh, this isn't so intimidating anymore. I'm not failing at this. I'm actually doing it. Now I just got to build the muscle.
Exactly. And it is something that does take time, and you have to invest the time really on a daily practice. And it's something that you can just start with 5 minutes a day. It's just pausing and noticing again. And the important thing is to get outside of your head. So it's even if you just notice, you're sitting at a desk and just noticing what's on your desk. It's like, wow, I'm like looking at my desk, like I have a lot of stuff all over my desk. Just noticing all the different items and how long that they've been there and what do they mean to me. And, it's just connecting outside of your head. It really helps. But there's other ways of meditating. Chanting is a form of meditating. So I encourage my patients to, find something that is in alignment with them as opposed to forcing something on themselves that they hate. So singing is very meditative. I enjoy singing. And so if they're drumming is meditative. So it's getting into this rhythm of sorts outside of your head and connecting with the environment around you and becoming more aware of how you are interacting with the environment. People tend to walk around like robots, just twirling in their heads, right? Going from one place to the next, to the next, to the next, and just like they're not even thinking, they're just doing, right? What's the next thing I do? What's the next thing I have to do? What's the next thing I have to do? What's the next thing I have to do? It's just boom, 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 right?
Yeah. I've noticed as my patients are going along farther in their process, they're just more clear-eyed and they're just appear to be sitting easier in their skin. They're just more at ease.
Right. Yeah. And it's, again, asking the question, why? Well, why am I doing this? What's the purpose of this? Some people do things because they think that's what they're supposed to do. And they arrived at the decision years ago and they just started doing it. It's like, well, maybe that worked for you then. Do you really still want to do it now? How is this working for you now? Because as you age, you have to evolve and you make changes based on what your needs are now. And so what you started to do years ago may not necessarily work for you now, but you're just doing it just because you've been doing it, right? It's always evaluating. And again, that takes time and pausing and stopping and evaluating. And when I say evaluating, I don't mean overthinking things, because sometimes
awareness, act,
do that. Yeah.
Measure, awareness, act.
Right.
Measure, process. Yeah.
Process, exactly. You want to process things and take a step back and observe what's going on, observe and ask yourself these questions. Why am I doing these things? For what is the purpose of this for me right now? And so in my book, there's this task that I give people that can be daunting for some people, but it's also very revelative. I don't know if that's the right word.
It's a good word.
But we just made it up. So, but it's called the Perfect Life Vision. And it's really looking at, and it's a coaching task that people do in the health coaching space. It's basically looking 10 years ahead and looking back of all the things that you have done. And so it's basically a task of dreaming and thinking, what do I want? You know, where do I want to be 10 years from now? What do I want? Because so many times people are just, you know, just doing, like I said, with no destination really. You know, what am I really trying to accomplish? You know,
it's sort of that transformation or projecting through again, isn't it?
It is, absolutely. So this is the kind of work that I do with people in terms, because that is the stress piece. You know, when you have a destination and you have a clear idea of what you're doing, why you're doing it, where you're going with it, it makes you, it allows you to make decisions about when things come up. Is this supporting my vision or not? Sometimes people have trouble making decisions about life because they don't even know where they're going or what they want. So it's hard to make decisions that align with that vision or not, right? So so having that vision is really, really important. So that can calm people down. Just even doing that task makes a clear, very clear path.
Right. I find as people are on their path, then that sense of fatalism drops away, because they sense that they're moving. And then what I hear you saying is they get a compass heading and they can make decisions about what is or is not in harmony. And if they feel that the binge or the setback or the falling off exercise, instead of beating themselves up, they can just come back full circle to that state of clear-eyed sort of harmoniousness in the now of, okay, is this in harmony with who I want to be and where I'm going? And just keep moving. Right.
So stress tends to be what keeps people, I think, from moving forward, and they end up being on this gerbil scale. What is that called? A cage. You know, they feel like they're not moving forward, but so it is important. If stress is a big factor, it's really important to start that upfront in starting a practice, at least starting, because it is something that develops over time and it does require practice.
Well, I want to be respectful of your time, and you've been really generous with it today. And I think this is going to have a wonderful impact on a lot of people. So I just can't thank you enough. And I can't thank enough the people taking the time to join you and me.
My pleasure.
Thanks for what you're doing. Thanks for the light you're bringing your patients into the world.
Yeah, it is definitely something that I've been wanting to do for a while, and I'm glad to provide that opportunity for, people to work with me, and hopefully everyone will benefit from this podcast or that you're putting together.
Wonderful. Thank you again, Dr. Stein. Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.